The John Locke Foundation is releasing a new spotlight report that focuses on direct primary care. The author of that report is Katherine Restrepo. She is Health and Human Services Policy Analyst for the John Locke Foundation. Katherine, first of all, tell us, what is direct primary care?
Yeah, direct primary care. In exchange for a monthly fee, around $50, you are entitled to around-the-clock care to see your doctor. You can schedule same-day doctor's appointments. Doctors in North Carolina can prescribe prescription drugs in-house for you. So for X amount per month, equivalent to a gym membership, you have 24/7 around-the-clock care.
You think that North Carolina should open the door to more of this. Why is it a good idea?
Yes, it's a good idea. North Carolina is actually very friendly for direct care practices, and the key here is that these doctors do not deal with insurance billing whatsoever. So because they can nix out 40% of their revenue just spent on getting paid by insurance companies normally through a traditional insurance-based practice, that is why primary care is so relatively inexpensive to administer for them. So it's a benefit for patients. They can spend more time with their doctor, and it's great for the doctors. As far as North Carolina opening up the direct primary care floodgates, it would be a wise decision, like other states have done, to clarify that direct care is in no way insurance, because some interpret it that monthly periodic fee you're paying is equivalent to a health insurance plan, but it's not. It is a medical expense.
And you think state lawmakers should actually take an active step to say and clarify that this is not insurance?
Yes, and if they just clarified that through legislation, direct care practices would not be subject to regulations perhaps in the future under the Department of Insurance, and it could really rekindle the appeal of the primary care profession.
Does this also have benefits in terms of health outcomes?
Yes. Now, the data is limited because a lot of these practices are maybe 1, 2, 3 doctors together. A lot of them are solo practitioners, but there are some direct care networks, and they're much larger, and they really focus on contracting with large employers as their clients. So Q-Liance is one. It was established in 2007 out in Washington State, and after 2 years of comparing patients that through large employers like Expedia or Amazon who went to see a direct care doctor compared to other workers who went to a traditional practice, there was an overall savings about 20% in healthcare expenses just because of direct care largely.
Well, we have scratched the surface of this report. If you'd like to learn more, you can log on to johnlocke.org and click Research.